orange, COVID cases aren't going down.
Cases are sitting around 7,000 to 8,000 a day. So I asked the Minister for COVID Response if these levels of illness and death are what the government expected.
The case numbers have been trending down, but we've seen in the last 2 weeks or so that maybe things are starting to plateau a little bit. That's not to say that the overall trajectory is not still heading down, but certainly the decline in case numbers has slowed in the last couple of weeks.
Yeah, I mean, Christchurch Hospital, though, says it's got more cases now than at the peak. Does that concern you?
It's very variable around the country. Christchurch does, for some reason, seem to have been hit hardest a bit later in the outbreak compared to some of the other DHBs. So that's something certainly to keep an eye on. But yeah, there's no question that they do seem to be under quite a lot of pressure there.
Yeah, I mean, are you expecting the trajectory to go up or to go down? I mean, because the rolling average seems to have ticked up a little bit in the last week or so.
All of the forecasting is suggesting that we should still, trend down based on the current outbreak. What we don't know yet is, reinfection rates and how we generally the view is that you'll get at least sort of 3 months before you get a round of reinfection.
Yeah.
But the international evidence on that is still emerging as well.
Yeah, just on the reinfection rates, there seems to be some opinion out there that it's not 3 months anymore, and that in fact you could get reinfected a lot earlier.
There are certainly anecdotal reports of people being reinfected earlier than 3 months, and so we'll certainly be keeping a very close eye on that.
Are you actually tracking that?
Yeah, but I haven't seen no data yet, confirmed data yet has come through about rates of reinfection.
Do you think people are a bit more lax about the fact that, if I get COVID, I'm okay for 3 months, and so they're out and about and they're not mask wearing, and that's causing perhaps this long tail of higher case numbers?
I think people are still being quite sensible in their approach to COVID-19. That's not to say that there aren't some people who are not being careful, but we're still seeing good levels of compliance with mask use and the various other restrictions that are in place.
You're happy with how people are responding?
Overall, yes, and we're seeing examples of people wearing masks when they don't have to because they're doing that as an extra protection for other people, and that's certainly a very welcome development.
A lot of rules have been relaxed recently, moved to orange, reduced masking, opening borders. I mean, but the death rate's about 20. Did you relax too soon?
No, not at all. I mean, if you look at our excess mortality, so how many people would we normally expect to see die in a year, and how far above that are we? Now, we are above that, but we're monitoring that closely, and it's not a huge leap above that. Now, it is above. There's no question about that. COVID-19 is having an impact, but we're keeping a close eye on that.
So the level that we are above, the normal rate of death, is acceptable for the settings that we are in?
I don't think I would ever say that COVID-19 related deaths are acceptable, but there is a reality about the fact that as we move from an environment where we were completely eliminating the virus and not having it circulating at all to one where we are seeing COVID-19 circulate in the community, it was going to have an impact, and it is having an impact.
Yeah, I mean, you talked about the long-term trajectory still going to be going down. Do you have any prediction as to when these death rates are going to come down?
That's very hard to model. We know that our rates of hospitalisation are starting to trend down. That's a good sign. That does indicate that we could see a decline in mortality rates sometime after that. But then there's still a lot of water to flow under the bridge yet. We've still got winter coming, for example. We've still got the potential for another peak as we head into winter. And so, the pandemic is far from over.
Epidemiologists like Michael Baker are saying, look, we need to do something to dampen down these infection rates as we head into winter. Is there any chance that you would change settings?
We are doing a lot to dampen down infection rates now. I mean, we still have some rules around mask use, that we are still within the COVID-19 protection framework. We've got people clamouring on one side saying, just get rid of all of the rules, let's just get on with life. And then people on the other side saying, actually, we need a much firmer approach. I think we have got the balance about right here.
But there's no plan to, say, increase settings, seeing as we got this rolling average of 7,000 to 8,000 cases a day.
Well, we're absolutely monitoring it on a daily basis. I get a daily update on all of the statistics around COVID-19. We keep that under close watch, and we do have to be prepared for the fact that as we head into winter, we could see a resurgence, and we could see that we have to take additional measures in response to that.
Is that being predicted?
It's a possibility, and and a strong possibility. I think it would be fair to say.
A strong possibility.
Yeah, that we will see another, increase in case numbers as we head into winter.
Right, and is that are you predicting the current variant, or are you predicting a different variant?
Well, that of course is the big unknown.
All right, at the moment, school kids under 12, only 23% of them are double dosed, and yet, like schools last term, 51% of them still had COVID cases. Do you think that you've relaxed mask wearing in schools too soon?
We've left it over to the schools to make decisions about mask wearing. So those schools where they think it's still justified, it's still adding a layer of protection that they need, they can continue to have a mask wearing policy, and many schools are doing that, and they have our full support if they make that decision. Schools are in the best position to be able to determine what they think is the need within their community.
The school has just come back under orange, borders open, no mask wearing. Are you concerned that there could be an uptick there?
I'll certainly be monitoring that very closely.
The third booster is probably waning. The immunity is waning from the third booster now. So what about a fourth booster?
I think it's likely that we'll see the need for ongoing protection against COVID-19, particularly for more vulnerable communities. So we're working our way through that at the moment. It might not be that we have a fourth dose for everybody, but it might be that it's available, and I think it's likely that it'll be available for our elderly population, those who are immunocompromised and so on.
And
we're working through that now. We're obviously following the international evidence around that very closely. Not many countries have been doing it yet, so the evidence there is still quite light, but we're looking at it pretty close.
But isn't there urgency now, because that third booster immunity is waning, especially for people like the frontline health and border workers who they got theirs back in December?
Oh, look, we do view it as a matter of urgency.
Right, so can you give us an idea of when you will make a decision about that?
Look, it really depends on what the evidence starts to tell us, and the evidence at this point is still quite light.
There's one other thing that you're adjusting, and that's the current vaccine passes. They expire on June the 1st, don't they? And are you developing a new system?
Yeah, we said when we removed the compulsory nature of vaccine passes that we would issue new vaccine passes on a voluntary basis.
But why do that if they're not required domestically?
Well, for those who want to be able to prove that they have been boosted, for example, they'll be able to download a new vaccine pass that shows that. It does mean that it's there in reserve in the event that we needed to use a system like that again in the future. Now, there are no current plans to do that.
Will you have to have a booster to get this new pass? Because currently it's a double dose pass.
We've got to work through that to make sure that we're not unfairly treating people or penalising people who, for whatever reason, can't get there.
So it's unlikely that you'll have to have a booster to get this new vaccine pass?
If you're an adult over the age of 18, yes, it's likely that you'll need to be boosted in order to get the pass. But we have to have a system in place where if you can't get a booster, that there's another way that we can make sure that you're properly supported.
Okay. So, look, we've opened up to the world, almost totally, but airlines and airports really want you to drop the requirement for pre-departure negative tests for travellers to New Zealand. Will you do that?
We're looking at the evidence pretty closely on that. We're looking at what the rest of the world is doing around that. It is something, again, that's under active review. We haven't made a decision on that.
But the rest of the world, like countries like Australia, UK, Canada, they've all dropped them, and we're competing with them for tourists, aren't we?
Yeah, so it is something that we're looking very, very closely at. And yes, what the rest of the world are doing is having a bearing on our decision making.
Okay. Soon?
Within the next few weeks, I think we'd be able to give people some more certainty around what's going to happen there.
And just finally, on the COVID fund. So the Auditor General is concerned you haven't been transparent enough with $74 billion of the fund. Do you accept that Labor has been spending it on some pet projects that are not COVID related? That's what the opposition alleges.
No, I don't. I mean, it's a COVID-19 response and recovery fund. The vast bulk of that spending has gone into response, so doing things like the wage subsidy, making sure that we're properly supporting the health system, rolling out the biggest vaccination campaign we ever have.
But what about
projects? Recovery? We didn't want the economy to collapse whilst we're going through this. So yes, we've spent it on, we've had shovel-ready projects that we have been supporting. We've upgraded school classrooms.
Jobs for nature? Is that a COVID recovery fund?
They keep people in work. They make sure that the economy keeps moving.
Electric ferries?
These are things that are going to leave a legacy for New Zealand from
cameras
our
on fishing boats?
COVID-19 response.
cameras on fishing boats?
Look,
I mean, do they qualify as COVID response?
Oh, look, like I said, it's a response and recovery fund. So it's also about making sure the economy bounces back from the challenge of COVID-19. This has been one of the biggest global economic shocks that we've experienced in any of our lifetimes.
So the government's quite proud of its COVID response, you agreed?
Oh, absolutely.
Yeah.
Look, I think we've had one of the best economic recoveries in the world. We've had one of the lowest mortality and case number rates in the world.
So why are you suffering in the polls then?
I think it's been a bumpy start to the year. There's no question that the cost of living is having a massive impact. That's an international phenomenon.
I mean, the shine is coming off Jacinda Ardern finally. So if she says, OK, I'm going to pack it in, who's going to be leader? Is it going to be you or is it going to be Grant Robertson?
Oh, look, I have complete confidence in Jacinda. I think she's doing an outstanding job and she's led New Zealand through a really, really challenging time. I know that she's intending to stick around for the next election.
And you know that for sure?
Absolutely, and I fully intend to support her in that endeavour.
So you're ruling out ever wanting to be a leader?
Oh, absolutely. Look, Jacinda Ardern is the Prime Minister of New Zealand. I think that she is the right person to be the Prime Minister of New Zealand. And, you know, I'm absolutely confident that we can, you know, with the election, we're only halfway through the parliamentary term. There's still a lot of water to flow under the bridge. And we'll be going into the next campaign to win it.